Right. Hello to everybody watching this. A lot of people are confused on what's going on with the ACA, which is the Affordable Care Act, or the previously known as the marketplace plans, which used to be you used to be able to shop on the healthcare.gov website, which is the health insurance marketplace. Now, this year, this is specifically for Illinoisans, for people living in Illinois. This year, the state of Illinois rolled out their own exchange or their own marketplace known as Get Covered Illinois. Now, what can be confusing is the internet highway is Google search, even with the rise of AI, right? So when you select or when you look up Get Covered Illinois plans, you have SEO that comes up, and you have all these different options. You have these are sponsored, by the way, right? So there's Get Covered Illinois, there's Am Better, there's Compare Health Insurance, there's Open Enrollment Healthcare. And consumers, generally speaking, don't know what to select. So I'll walk you through it. So you're going to select the .gov website, which is Illinois' government website, right? Which is this one. So getcovered.illinois. Here, okay, there we go, it loaded. So it's going to be getcovered.illinois.gov. Now, how do you get started? Because when you're on their website, they have a bunch of information, right? It can be very confusing. So to get started, we're going to go where it says plans and costs. Once you're there, if you're ready to select the plan, you can just go to plan choices. If you want to find assistance, you're going to go down to where it says get help. You're going to go to where it says get help, right? So get help, and then free local help, or contact your insurer. Most people are going to go to free local help. For this video, let's just go through the plans and see what that would look like. So we go under the plans and cost tab, and then we select the second option, which is plan choices. So we select that. And then it's going to take you to this other page where it says understand your plan choices, right? You're going to compare health and dental plans. You can read about the different tiers at different levels, which is bronze, silver, gold, and then catastrophic, right? Most people, about 70% of consumers in general, are going to select the silver plan, which means they have like moderate costs and then also moderate out-of-pocket expenses, co-pays, co-insurance, deductible. These are some of the insurance carriers on Get Covered Illinois State Exchange: Blue Cross and Blue Shield, Am Better, Cigna, United Healthcare, Oscar, and so forth, right? So we go back up here, and then you select where it says compare health and dental plans. Okay, so where it says shop for health coverage, right? You read what it says there. It's simple. You answer some questions regarding your savings. You'll be able to preview plans in your area. You complete the application for coverage, and then you can choose a plan. You pay the first premium, and you're covered. So we select continue at the bottom. Now you're going to type in your zip code. So I'm just going to type in a zip code that's coming to me at the top of my mind. The top of my head is 60639. Okay. So it's going to, and then it's going to, after you type in the zip code, it'll show you what county you're in. A large percentage of enrollees are going to reside in Cook County or in the surrounding counties. So the second question is, who is in your household and do they need coverage, right? So you'll type in your birthday. So the little asterisk sign, the red asterisk sign, asterisk. I don't know if I'm pronouncing it right. So you have to fill that in, right? So let's say it's a person that's born January 1st, 1985, right? And then it'll ask you if you're seeking coverage. You select yes. If you're a tobacco user, you select that option, right? If you're American Indian or Alaska Native, you select that option. And if you are currently pregnant, you select that option. You can add a spouse here, right? Or you can take them off by selecting a little X. And you can add a dependent as well, or you can take them off if you don't have any dependents. Now it's going to see, the third question is, it's going to ask for your approximate annual household income for 2026. You can update it throughout the year. So if you go to the casino and you win big, right, and you need to adjust it, you can adjust it. Bonuses, overtime, and so forth. But you're simply entering an approximate income that you believe you'll earn for 2026. So for this example, let's say it's going to be a person, household size of 1. Let's say they'll make about $40,000, right? And then you can actually, if you hover over where it says tax household income, it's going to say this is the total income for everyone listed on your tax return. In this case, we're keeping it simple. So we will hit continue, select continue. And then where it says your results, right? It's going to give you an estimated tax credit, which is the assistance that you'll receive based on your income. It's also known as an advanced premium tax credit, which gets applied to your total cost and it reduces your monthly insurance bill or your monthly premium, right? Okay, we select next. So here, this is a needs assessment. So with this, you'll be able to determine which particular healthcare providers, doctors, nurses, clinics, hospitals are within this network, right? So if you have a particular doctor, you just start typing it in, and then it comes up with different physicians. It's not always 100% accurate, but overall it's pretty good. And then you select the radius, right? And then the zip code. For this one, let's just say there's no medical providers that somebody has. Then it's going to ask you, the second question is about your healthcare needs, how often you go to the doctor. Let's just keep it at, let's keep it at 3 to 4 times for the year, right? So we'll select next. But obviously you want to adjust it to how many times you go. So we'll just select 3 to 4 times a year. If you take any prescriptions, select that. If you take 0 to 2, 3 to 4, 5 to 11, or 12 or more, right? You select that. Right now, let's keep it at 0 to 2. And then if you do take prescriptions, you can actually look up the prescription here. So let's say torvastatin is a common medication that people take, right? Or for high blood pressure, lisinopril. So if you take lisinopril, you type it in. If you don't know how to type it in, go on Google or AI, whichever AI platform you prefer, spell it out there, it'll give you the correct spelling. Or look at your medication, right? Your medication container, prescription container. All right, so we won't select any for this example. So this is optional, of course, as it says up here. We'll go to the next page, and then the next page is children's dental. In this example, there's no children on the plan, so we'll just select view plans, right? And as you can see at the top where it says, please answer the questions below 5 out of 5. You can always skip to view the plans. I was just going through the example so you can take a look. So let's see. So right now at the top where it says back to preferences, the upper left-hand corner, right below it, it says 76 health plans, which is, it's too much info to process, right? So we're going to select certain types of filters to help you find the best plan. Because there's no best plan for all. It just comes down to your specific circumstances. So let's say you want a deductible that's $2,500 or less for the year. Let's say you want to stay with a silver option. So simply by adding those two filters, a silver option and a deductible that's $2,500 or less, you went from 74 plans down to 2 health plans. But let's say, look at that monthly payment, right? There's $420 and then $902. For a lot of people, that's going to be pretty expensive. So we can also select, let's say, we'll select a higher deductible, and that went from 2 plans to 10 plans, right? Okay, so that's more reasonable now. And then, so on the left-hand side, you have the filters. So you can sort the plan by the expense estimate, monthly price, preferred provider or network, deductible and out-of-pocket expenses. You can also select it by the type of network, HMO, PPO, POS. You can select if it's, you just want a standardized plan or an HSA plan, which is a health savings account. You can select by the metal tier. So there's gold, silver, and bronze. And once again, most people will select the silver plan. You can select by the deductible, you can select by the company, you can select by the quality ratings, which I would say the quality ratings are overall, it's not something you want to lean too heavily on. Just take it with a grain of salt. Now we go up here, and let's say this individual, right, that's looking at these plans, likes the Blue Cross and Blue Shield plan in comparison to all the other options, right? So here we select it. So we go to details, right? So let's say the individual, the plan highlights is read the plan highlights, right? The name of the plan is My Blue plus Silver 906. Their primary care copays of $30, 0 co-insurance on generic drugs. There's a deductible, right? You can read through the summary of benefits and coverage. If you go down here, so as you can see, the deductible and out of pocket, doctor visit, test, drugs, or prescriptions, outpatient, urgent care, and so forth, right? So it covers what are known as the 10 essential health benefits. Now, this is only selecting the medical plan. This does not include dental and vision, which I'll make another video for that. But if the person selecting this plan is good with it, they select the add button, the blue add button. You add it, right? And then the website will give you an option to continue the dental plans. You can select the dental plan on there, or you can go outside of Get Covered Illinois and select the dental plan there. We'll just keep it simple for now. We're just going to keep it as just a health plan only. You continue to cart. So now once you're at the cart, right? So the health plan, the Blue Cross and Blue Shield of Illinois, My Blue plus Silver. And this is how much the monthly payment is. It's $585.30. But based on this individual's, the example of this individual making $40,000 in 2026, or that's what they're expected to make, they're going to receive a tax credit or financial assistance for $225. So then their new monthly payment, their premium, would be $360.30, right? They're happy with it, then they select next and register, right? And then it takes them to get their account set up. They start filling out the info here. Just waiting for this to load. Okay. So once they fill out their info here, right, then they set up an account on Get Covered Illinois. The plan should be selected already, and then they enroll themselves. If you have any questions or need assistance, the contact information to get in contact with me is below. Reach out with any specific assistance you need.